Thank you very much, Ranja. I'm Dr. Okech, and this is Doreen Bai, my colleague. Please come here. I'd like to greet you in Kisumu style. Machiegni uru Kisumu, karibuni Kisumu. The best city in the whole world, UK. You can tell your people that you are where? You are in UK, but don't explain further. So anyway, it's my honor that actually one of the first things I'm going to do, I'm actually Doreen's curtain raiser as a chief medical specialist KNH. We have worked together very, very closely in the area of gender-based violence services. Doreen is an expert in that particular area. There's a great concern that the social determinant, not a great concern, we all know that social determinants of mental health really do influence, and of health generally, really do influence people being subjected, especially women, to gender-based violence issues. And actually, my colleague is the one who's going to do the presentation, highlighting the social determinants of mental health, and then talking about a special case that she came across. Karibuni.
Thank you, Dr. And all protocols observed. Yeah, Ule. Okay. That's a greeting saying good morning in UK. Yes. We are learning something, and indeed we are here to learn. And without much ado, I want to go straight to the presentation. I know that I have only 20 minutes. Na mambo ni matatu. So I want to start by saying thank you to the KPA fraternity for allowing us this chance so that we can be able to bring about the discussion on the social determinants of health. I want to say that this concept affects our lives as individuals and also population. And also I want to say thank you once again to Dr. Violet. She knows how to throw me to that deep end in some of these things, and I'm grateful. And also to the Department of Mental Health, KNH, for allowing us to be able to share the case that we are going to be looking at. I want to go straight to some of the reflections of COVID-19 that's brought to all of us. And I want to say this became like a great equalizer to all of us. And we know some of the things that came about, what like necessitating us to have physical distancing. And this happened across the globe. And there was so much of the social inequities in health. And I want to start by saying the idea of mental health tends to happen overnight. And only what we can see currently is because we are using different lens into that. And indeed, there was a profound impact of COVID-19. When we look at the things around the physical environment, what happened when there was that physical distancing, and also there were measures that people were contained within their very homes. We saw many things came about, and this affected those who have and those who have not. And we also know that during that time, there was an increase in food insecurity, especially for children who are getting advantage of having the feeding program within the schools. And therefore, the effect of the effect of COVID brought about some of these issues around health that now they are referring to biopsychosocial spiritual model. And therefore, social determinants, these are the conditions in the environment which people are born, they grow, they work, they live, and age. And simply these are just a set of forces and the systems that shapes the conditions of daily life. And I want to say that these conditions affect us differently as individuals and also as a population. We all want to live in a very safe environment, whether that means it's a place that has no violence at all, or little of it. And we see that these social determinants of health can influence health in a different way. Most of the time we are so keen in looking at the negative ways, but we also know there are other positive ways. Because if one lives in an environment whereby they are able to access all that they need, and especially like looking into very simple things sometimes we ignore, like having the drinking water that is safe. And I came across a research that shows that people who are not able to have clean water, it increases the levels of anxiety and also issues around the mood. So therefore, it is very, very important to look at these issues even when we are looking at other aspects that affect the wellness of an individual. And the evidence shows mental health and many common mental disorders are shaped to a great extent by socio-economic and environment factors. Numerous studies suggest that SDOH accounts for between 30 to 55% of health outcomes. As I alluded earlier, not only medical factors that really influence the health outcomes. And therefore, social determinants of health considers both mental and physical health and also the implications that they are in, and I mentioned earlier, socio-economic and physical environment. So, social determinants of health is able to enhance our knowledge about the many interacting forces. And all these forces are the ones that shapes individuals and also the collective level of mental health and well-being. And therefore, there is a need to set out actions that can be pursued so as to promote and protect good mental health. I want us quickly to look at the domains in which these social determinants of health affect. And I'll start with the neighborhood and the environment. Because I started saying the family conditions, the quality of parenting also affect the outcome. And therefore, we have like one neighborhood and environment, and we all agree that most of our behaviors are shaped by the environment. The environment shapes the behavior of an individual to a great extent. Healthcare, reflecting back to the COVID-19, the access of healthcare was quite a challenge. And it was not to the low-income people, but also to those people who we think they are doing pretty well. Education is also another domain. Social and community context, the setting in which people live and work, relationship with people, and this can happen in various also connections in the social, religious, cultural occupation, and also looking at economic stability. We are going to look at that case study that is going to show all these domains that we came about. Just to refresh our minds, what WHO talks about when it comes to mental health, and we know very well it's just a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruit-free, and is able to make a contribution to his or her community. And when I looked at this definition keenly, I was wondering, sometimes when we think of mental health, what kicks in is when we are looking at the issues around mental illnesses. But you see, an individual might lack potential to cope with normal stresses of life. At the moment, we can't talk of issues around the financial bill, the housing levy, the inflation rates, the taxes,
And people have tried to come up with ways of coping. But you find there are other people who are not able to progress at all. That person may not necessarily have mental disorder or any form of illness. Can one be able to work productively, or we just sometimes present to work and just be passive at work because we are there maybe 8 to 5? What about fruitfulness? What about ability to make contribution? That is very, very key when we are thinking about mental health. And it's always good to take a stock of our lives and see, are we really in that place that we are really enjoying mental health? And if not, can we be able to reach out for support? And I know there is a place for wellness even within this conference. The absence of mental disorder does not necessarily mean that the presence of good mental health. And I think I've been able to stress on that. People living with mental disorder can also achieve good levels of well-being. That's where they're able to live a meaningful life, satisfying, and they're able to contribute to life despite the constraints of painful, distressing, and debilitating symptoms. When we talk of common mental disorders, we know they result from stressful experiences. And I want at the back of your mind still to have those domains that we talked about. And they can also occur in the absence of such experiences. And let me give you an example of maybe this person who just find pleasure in maybe something to do with alcohol. And that is where they enjoy, or any other form of substance. And in the process, they get substance-induced psychosis. So it's not only in the stressful experiences, also in a place where maybe one is enjoying himself or the other self can be able to get into that place. And stressful experiences do not always lead to mental disorders. And that's why we say there are people who have the ability to cope with stressful experiences. Many people experience sub-threshold mental disorders, which mean poor mental health that does not reach the threshold for diagnosis as a mental disorder. I want us to do an exercise. A teacher who teaches always gives questions so that can be able to see to what extent. So the one who is going to mark your exam is the one seated next to you. So with the domains that we talked about, maybe I can go back a bit. With those domains, economic stability, social and community context, neighborhood and environment, healthcare, education, I would want you to put one of those. What is happening? Is it about, that is the reality that we can see? Is there equality? Is there equity? And is there liberation in those social domains of social determinants of mental health? Have we gotten the question? No. Let me repeat once again. With those social determinants of health, economic stability, social and community context, neighborhood and environment, healthcare and education, where can you place that? What is happening with economic stability? Is it a reality we are seeing? Are we seeing equity, equality? Are we seeing liberation in those domains? Does that make sense? Yes, I can hear some yeses, and because my time is running,
Allow me to very fast present on this case study that we came across within the unit. And this was a female aged 42 years, married with 3 children, 11, 9, and 7, and a diagnosis of schizophrenia with GBV. And we see in the social community and context, she was overly silent and detached. She had persecutory delusions, and there was lots of ignorance from that community that they couldn't tell what was happening with this particular person. This female was married for the last 17 years. A firstborn in a family of 4, doing very well, very stable, no history of mental illnesses even within the family. And she was only able to access her education up to O-level education with tertiary training in dressmaking and food processing. In terms of healthcare, when she was enrolled in the facility, the time she came to the facility, she talked of she was being treated on the issues of her bladder. That's what she knew about accommodation. And so most of the time she could miss appointment. She was having poor medical adherence. She was sometimes self-medicating because she didn't know what to do when she didn't have drugs. And there was also, when she came to the facility, considering she was coming from very far, the turnaround time used to be quite long. And also accessing to the facility sometimes was not so easy because a brother was to get maybe a cab to come pick her, bring her to the facility. If there is no provision of transport, she would not come. What about the environment where she was living in? There was so much unfriendly. At some point, talked of a roof sometimes could leak where she used to sleep, but no one bothered about that, even when she tried to reach out to the neighbors. She was undergoing gender-based violence, which at the long run brought about the issue of schizophrenia. There was still poor support system. In this regard, that she was a religious person who could, go to church and believed that this could be a bewitchment and it was not an illness. And so she couldn't even get out of her family, the environment she was in, because she thought that if she get out, what will people talk about? And when it now comes to the domain of economic, she was not having any financial freedom. At some point, the husband had to ensure that she was kicked out of a workplace. Let me finish up by saying this. A healthy body requires a healthy human, which will make finally a happy human around. And when a happy human around is found, then they can be able to know how to navigate in their various domains that they find themselves in. And finally, social determinants of health are not only have a negative influence, also there is a positive influence to that, if at all people are able to know how to navigate around that. Thank you so much.